This is an interesting one. It says, I have autoimmune thyroid disease. Is there anything I can do to reduce my antibody levels? So if you were posed that question by someone in clinic, what would you say to them?
That's a tricky one. I might deflect it back to you in a minute, but I guess it partly depends, doesn't it, on what antibody it is and what the cause of that autoimmune thyroid problem is. Because I think in the patients we see with Graves' disease, which is obviously autoantibody related, I think that taking your medication well, that you're prescribed, doing all the other things right that we've been talking about, getting good sleep, getting some exercise, healthy diet, all those things are really important to help try and bring your antibody levels down. But I think there's always a lot that you read, isn't there, about sort of faddy diets and supplements and things, and I'm not sure there's really any evidence particularly for anything per se to bring your antibody levels down. I mean, I know there was some research a while ago, wasn't there, about selenium and vitamin D and things, and they may make a tiny little bit of a difference, but I think people can get very caught up on trying to bring their antibody levels down, whereas actually just trying to be healthy and take the medication is probably just as important. Is that?
Yeah, I think that's really wise words, Claire. That would be my take on it as well. I think that whilst you mentioned selenium and vitamin D, and people have got excited, haven't they? But the research hasn't really been consistent in terms of showing a substantial effect that's worth having. So yeah, I totally agree with what you're saying. In many respects, I suppose there are other bigger pieces of pie again, I guess, the just looking after yourself in a more general sense from a dietary, sleep perspective, exercise perspective.
I think the other thing to mention there maybe is I get a lot of patients coming into clinic, quite fixated on their antibody levels, particularly with an underactive thyroid, and we don't tend to measure them routinely, do we, from, baseline, because actually the antibody level itself isn't necessarily going to tell us what we need to do to the medication or how that person's feeling. So it's a little bit more linked, isn't it, with TRABs in Graves' disease. But, often I think, seeing a tiny fall or a tiny increase in your antibody level isn't actually a big deal.
I guess you mentioned TRAB, which are thyroid receptor antibodies, and they're the characteristic antibodies of Graves' disease. And you did mention the fact that those levels can be quite handy. So if I had Graves' disease, thyroid gland overactivity with a suppressed TSH and high thyroid hormone levels, how would the TRAB guide you as a doctor when it comes to this, deciding about my treatment?
Well, I think we can just use it in addition to other things, can't we, as a sort of prognostic factor. So, we know that people who have a very high TRAB level at, time of diagnosis are probably less likely to go naturally into remission and probably going to need, a more intensive treatment course, aren't they? But equally, those ones with a lower TRAB and the ones whose TRAB level, drops really nicely on starting treatment, we can probably be a little bit more optimistic about their treatment course. I mean, I don't think we can necessarily, it'd be great if we could, but we can't say, yep, your TRAB level at diagnosis is that, therefore you will go into remission. But I think we can be guided, can't we, by how they respond.
So it provides you with a bit of a steer, basically.
Okay. Yeah, that's what you've told me anyway. So.
Yeah. So if I had Graves' disease and my TRAB levels are high and now they're low, then it might be worth, is it worth thinking about stopping medicine?
Yeah, I mean, I think if you had been on, your carbimazole for a couple of years, it was at a good time in terms of other life events. I certainly wouldn't want to be fiddling with your regimen just before your GCSEs or something, but if it was a good time and you were keen to have a go and, everything else was sort of lined up, then if you had low TRABs, I'd be much more inclined to say, yep, that's a good idea, rather than if you had really high TRABs, were on a really high dose of carbimazole and your bloods were all over the place, for example.